Good afternoon, everyone. Thank you for joining us. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions and addresses the latest COVID headlines every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest news through today, the 4th of November. We invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Puskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Hi.
So for some updated COVID statistics. Right now, one of the biggest ones is that we're seeing a slight increase in the daily average cases in the United States. We were at 72,000 last week, and now we're hitting 73. While the decline is still 8%, it is higher than the 13% it was a couple of days ago. In a few select states, we're seeing a very high increase in cases, such as Arizona with a 50% increase, California with a 25% increase, and Colorado with a 23% increase. And there are numerous states that are seeing about 10% increases, such as New Hampshire, Utah, Mexico, Iowa, and Nebraska. In Illinois, we're also seeing an unfortunate increase in cases with 2% increase over the last 14 days. While that feels small, we were seeing a steady decline for quite some time. What can you tell us about this increase in cases in Illinois that we're seeing?
Well, I mean, take a look at the whole picture. What's happened is this big decline from this fourth wave is stalling. It's not continuing down to the bottom. There's still, 75,000 cases per day. The state is up a little bit. You have to be very careful about looking at day-to-day changes just because there's just so much weirdness with the reporting and stuff. But you look over time, but it looks like the improvement from this coming off this wave is stalling. This is not a good sign. You have big increases in Colorado, Arizona, California up 25%, 2% in Illinois. The United Kingdom is like slipping out of control again. So it's not just a US problem, it's a global problem. What is happening? Has the virus changed? Are the people just tired of COVID and they're just tired of all the mitigations and they're just willing to put their lives at risk? I don't know. I don't know what it is, but hey, this is not over, and it can be addressed in the ways we've talked about. More vaccination, more mitigations, and maybe some new therapies that could be game changers.
Yeah, absolutely. And for stopping the spread, there was the approval for children ages 5 to 11 to get the Pfizer vaccine. This happened on Wednesday. What can you tell us about this?
This is huge. This is really gigantic. So this is the little 10 microgram dose of the Pfizer vaccine. Gets EUA approval for children 5 to 11. So now all age kids at school can get vaccinated from 5 to 18, whatever. The whole school system can be vaccinated now. Kids are already lining up, and what's going to happen here, it's appearing, is that the people that really want to protect themselves and others. Remember at the beginning when the adult vaccines were approved, it was hard to get a vaccine. People were driving to Peoria and Quincy, Illinois, and Carbondale, Illinois, and other states to get the vaccine because they couldn't get it here in Chicago. They didn't have enough vaccines. Same thing now with kids, because the kids is a different dose. They can't just go grab the adult one off the shelf. They have to go get it's all marked differently so that there's no mix-up and stuff like that. So there's going to be a bunch of backup, I should say, in getting the vaccines out to the kids. My own grandchild has already signed up for her vaccines and ready to go. The sooner the better. And this is a great thing. This is 28 million people. And so that's going to have a big impact in the overall spread of the pandemic.
Yeah, absolutely. And with another very exciting approval, the UK is first to approve the oral COVID drug. What can you tell us about what this will change in the UK?
Yeah, we've talked about molnupiravir and a couple other drugs that are in development. These are just pills. You take them as soon as you get sick for 5 days, just 5 days worth of pills, and they reduce hospitalizations and deaths significantly by over half. So it's not as good as the monoclonal antibody, but it's a pill. You can take it. It's just incredibly more convenient than going and get an intravenous infusion. The government has bought many doses of this, so the looks like the pills will be free. I mean, not free. The government has paid for them. I think the companies are charging $700 for those 5 days, but that's compared to over $2,000 for the monoclonal antibody. Plus, that has to be given by infusion in a hospital setting or a clinic setting. So there's advantages to this, and I think it is going to be a game changer because pills are located at pharmacies, and their pharmacies are everywhere. And Merck, who's behind this with Ridgeback Pharmaceuticals, has already really planned for a rollout of this compound, and I think it's going to be big.
Yeah, definitely. And as we talked about on Tuesday, with companies enforcing the mandate for companies over 100 people, it has now been pushed to January 4th. Why do you think that this push has happened, and what will this do in January?
Well, there's so many companies with over 100 employees. I think the rollout of that mandate it's more complicated than originally thought, and you're doing it in states that have mandates against mandates, laws against mandates, and they've got to sort all that out. But okay, so it's delayed another couple months, but it's coming, and the courts are holding it up. And one of the big groups is the Chicago Police Union is against the mandate, even though the leader has been vaccinated himself. But the good news on the Chicago police side is that their vaccine uptake is now 76%. So this may not be such a big issue by January 4th. And there's alternatives. They can, this is regards to anyone, they can have frequent testing every week or twice a week. Some companies are going to make the employees pay. Some are going to do it for them. It's kind of all over the place right now, but there's ways around that if you really don't want a vaccine, but the vaccine is the best way.
Yeah. And going back to the children's approval, there's been a lot of anti-vaccine information regarding children and the vaccine.
Mm-hmm.
How will this change the way that parents will vaccinate their children, and do you think it'll change?
Well, there's been a lot of anti-vaccine misinformation before COVID even happened. The anti-vaccine group is just, anti-vaccine, and they don't care. They'll sensationalize things. They'll put misinformation out there, and they'll keep putting it out there. And it's basically, and then the people that support that, it's just pandering. You have to look at all the data. These studies have been done in children. They're not seeing serious complications from these vaccines. This is just not true. This is misinformation. And what they neglect to show is that the impact of COVID. COVID, has caused in the 5 to 11 group over 8,000 hospitalizations. A kid in the hospital, that's really sick, and 170 death from COVID in kids in that age group. Let's see more about that than these cherry-picked cases, non-verified. It's just really, really unfortunate.
Yeah, it really is. And speaking of very unfortunate, who is dying of COVID right now? There's a whole new study that is showing that younger Southern, rural, and white individuals are dying of COVID. Why do you think this is the case right now?
Well, what's happened is the older the age group you're in is higher vaccinated because they're afraid. They got it. They got it. The reality is very close with them. And so because the vaccination uptake is skewed for the older, the risky ones are the younger ones. So you look in the hospital now, and the people are younger. There's very few older people. There's a few, breakthroughs, but it's mostly younger people down in 50s, 40s, 30s, 20s even, who are in the hospital now, unvaccinated. That's what's driving the pandemic.
Yeah. And with this follow-up article that just came out, quote, "This pandemic is our World War II," says a doctor in Florida. The hospitals in Florida are right now filled with ICU patients. Why do you think this is the case right now in Florida?
Well, Florida has very bad policies and communication issues. There's laws against mandating anything, and they're paying the consequence. The citizens of Florida are paying for it with their lives. They're loading up the ICUs, they're loading up the hospitals. The doctors and nurses there are saying this is like World War II. They can't handle it anymore. I mean, this is so unfortunate. The virus is the enemy. We have to work together. We know how to control this thing. Let's do it.
Yeah, absolutely. And now for some COVID questions from individuals. This individual got the Pfizer vaccine 5 weeks ago, and ever since then, they've had terrible stomach issues. Their labs came back normal, everything came back normal, and they're heading to the GI doctor today. Should they receive their second dose, being that their first dose might have given them terrible stomach issues?
This is very unusual to have gastrointestinal side effects. This could be unrelated. I don't know. I mean, this requires a specialist to look at them, really evaluate them completely. This person has some abnormalities in the liver, and they need a good gastroenterologist or a really good internist to really work this problem up and figure out what it is. Now, there's no urgency in getting the second dose. They can wait on that until this problem is resolved. We don't want this complication confusing the whole vaccination issue. So this can get sorted out over time. And if an employer is mandating it, I mean, this is a case where this would be a medical excuse. Like, we are working up this problem. We don't know if it's related to the vaccine. We are not giving the second dose at this particular time until this is resolved. So, this can be worked out, but this needs an independent medical evaluation by an expert before moving forward.
Got it. For the next question, this individual was paralyzed after receiving the Guillain-Barré after receiving the swine flu shot in 1976. They were advised to not get the COVID vaccine and also not get the flu vaccine. Do you think that they should get the COVID vaccine, being that they were paralyzed from the swine flu?
Well, this person's going to be in a lot of trouble if they get COVID. So again, it's going to be a risk-benefit ratio. Now, the current vaccines are not related to the flu vaccines at all. The other flu vaccines, besides the swine flu vaccine, do not have the Guillain-Barré side effect reported with them. So the options here are to take an mRNA vaccine, a Pfizer or Moderna vaccine for COVID. I would avoid the Johnson & Johnson vaccine in this person because that is associated with neurologic problems in men, and particularly men over 50 years of age. So I would avoid that one in this particular person, but I think the mRNA vaccine would be a good idea and a viable option.
Wonderful. And now for the third question. This individual was wondering, since they are a 68-year-old female with stage 4 metastatic breast cancer, they're on oral therapy, they have received all 3 shots. They were wondering if they should be attending holiday gatherings. Is it even worth it? Do you have any thoughts for a 68-year-old with cancer?
This is a tough call. Perhaps this person would be eligible for a preventive monoclonal antibody therapy. Prior to that, I don't believe it's approved in the United States yet, but it is approved. They've approved them in the United Kingdom, where they're giving intramuscular injections of monoclonal antibodies. So that would really be the thing that would be good. So it's a really tough call here, because this person is very high risk for running into trouble, and there's already enough trouble that they have already. So I think ideally, if they could get an infusion of monoclonals, that would be great. I'm not sure they're going to be able to find that at this particular point, but I know the companies after exposure, they are approved in that case. So that's post-exposure prophylaxis. This would be pre-exposure. That's only approved, I think, in the United Kingdom. You know, if they do go to the event and somebody does say, oh, you know, I had COVID or I tested positive, they could then get the monoclonal antibody before they get sick. So that's a possibility, but this is a very high risk situation for this person. I'm very sorry for the person, but you know, to be the safest, you would not be mingling.
Yes. And for our last question, this individual's wife had a breakthrough case in early October. Her symptoms were a headache for a few days and loss of taste and smell. She did not take any of the antibodies or medication. Her sense of taste and smell are mostly, but not completely back. She's a teacher and she's in contact with dozens of unvaccinated children every day. Should she get the booster right now, or should she maybe wait until her taste and smell are completely back?
Well, she can wait a little while. She doesn't have to wait completely for the taste and smell to come back, because sometimes that takes many months. And she's, you know, in school around kids. And I think that it would behoove her to go ahead and get the booster shot now.
Wonderful. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Okay, thank you.